I'm going to open my pack. This is what it looks like when you open in the lab. Except I wouldn't have this hanging on me. So now I would gown and glove. These are sterile, so I would drop my gown and glove. They're already there, but I would have these on I would have them on a table. So we'll pretend. Okay. Oh, here, I got it. Sorry, my hair would be up too, and I'd have a mask on.
Do you want me to tie the bone?
Yes, please.
That'd be a bad
That's okay. It takes a minute to learn how to do all that. Are you done? Yeah.
Oh, we can tap.
It's good. Okay, so I would have my sterile gloves. This is how I put my gloves on. If I can get it. Do not touch my glove. This is perfectly okay. If you can't get the pancake flip, I'm sterile. I'm gonna have to have you tie these. I'm broken. Okay. So when you set your table, you put your hands right here and move your table. My doctor's gonna come in that door. Wherever your door is located in your room, you're gonna put your doctor's gear toward the door. So that's my doctor's gloves and his gown, or her gown. There's my gloves and my gown go on top. For me, sorry, I didn't realize I was going to move the table. I'm still sterile because I haven't touched anything, so I'm okay to do what I just did to move that. This is not in effect. These are reused. This is my drape for my patient. So in my room right now, my patient's head is right here. So my gown, or my patient drape is gonna go on that end, near my patient. All your towels, my blue towels, I put up so I can grab them by that fold. There's a whole lot of stuff in here. This is your waste bin. That's where body fluids go. 4x4s, you unpackage these, take the bands off. A massive sharps box. Chloropreps right down here. I'm just trying to get through everything that's on the table so I can get a feel. This is not part of our pack, so you may or may not have that. Oh, that's okay. So what I like to do when I set my table is I like to take a blue towel and create my dry area. Thanks, Becca. Create my dry area, and this is where I like to work. So I get my towel ready for my patient's groin. So I hot dog, actually a hot dog, and then do it a third, because they get a very narrow towel. And then I like to fold mine in half, get that ready. This is the order I'm gonna use this. So I'm gonna use my towel, and then I'm gonna use my Chloropreps, and I'm gonna put my drape on. So everything's in order for me to grab it and go. My syringe is gonna come out of the package. I stick mine in here until I'm ready to put it on the patient for the doctor's access. This is a lot of stuff. So my medicine cups, I set over here so my nurse, my circulator, can come put fluids in them. And I want them as close to the edge as possible because they're gonna come and I don't want whoever's circulating reaching over my table. So I'm gonna set those there. My clips, I just leave in my bucket. I use this as my supplies I'm not gonna use, I stick in here because I like my table really neat and organized. This I'm gonna move more like here so the doctor can turn and stick his sharps or her sharps in there. My access needle, we have orange and bronze. So you're just gonna look at those and see which one is your thinner one, and so this is my lidocaine needle. I can look at how thin it is, and you can look at these later. This one's really fat, so that's definitely a fill syringe. These are lidocaine syringes. I have those ready to go. These are gonna be my flush syringes. I'm gonna have to use this for my fluid because I don't have a blue bowl. So my circulator will give me my hep saline.
So you're not doing this. Low and slowly pour.
And notice how she's not like reaching over my table or anything.
Yeah, you need to stand away. And she puts this close to the border so that we don't have to reach in over her field. So nobody's reaching in over the field that's not sterile, right? But she uses that heparinized saline, so a lot of times it'll be either you are drawing the heparin and putting it in the fluids as you are setting, or somebody's going to mix the heparinized saline and pour it in pre-mixed. Just depends on the environment that you're working in.
And they'll teach you how to. So what I do next is I take the lid from my waste bucket, and I like to take my 4x4s and I fold them. No. Okay. Yeah, thank you though. So I like to fold them like this because these are for the doctor. These are the sponges for the doctor. I fold them, fold goes that way, and then I take my fluid and I get them wet, not soaking, I just get them damp.
So she's not dunking them.
Not drippy, just damp, like this, just damp. So I set these up on the patient when it's time for the doctor. I put everything on my tray for the doctor. So my Lido syringe is gonna be on here. So this is, we're gonna, here, I'll pretend that Becca gave me one.
Well, I was gonna
Oh, you want
show
me
them
how to draw it up?
it.
Okay, I'll show them how to do it this way, and then I'll also show them how to draw it. So that's lidocaine.
So you guys are gonna practice this skill, I'm sorry, because this is something that you're gonna probably have to do. So when you are the
And
person who is holding this, I want you to put your fingers around this, but keep them back. So basically you're trying to hold the bottle toward the palm of your hand and keep your fingers back so you don't get stuck. You're also gonna brace this hand because you want to be stiff and sturdy, right? She's gonna approach and she's gonna draw from this bottle.
So I'm the one that's gonna move. So I'm gonna pull my cover off my railroad spike. I'm gonna put air. So Becca's gonna hold still, I am moving. I'm gonna stick that in the bottle, I'm gonna push my air into it, I'm gonna pull back my syringe, and then just gonna let that fill. And then Becca's still gonna hold still, I'm gonna pull out of that bottle.
I don't move till she's done.
Then I'm gonna scoop my lid, just like this. This is the only way to recap a needle. So you scoop with one hand, and now it's on there, and now I can switch from my filling syringe or my filling needle to my lidocaine needle, my thin one, and that's ready to go for my doctor. So I'm gonna put that on my tray also.
So you want to draw heparin?
Sure.
I mean, there's not really any fluid in here, but we'll do the pretend.
So we'll show you again how you do it.
So this is a smaller bottle.
Yep. Uncap your needle, look at your target, get some air, go into the bottle. Boy, that is. You're trying to hit the center of that stopper. Then you push the air into the syringe, into the bottle, and let it come back and fill up. And you just suck it all out, and then you pull away. And then again, you scoop your needle cap. Once it's on there, that's when you lock it in place. And then when I'm completely done with this, I'm gonna stick it in my sharps container.
But do you see how small that target is? So you're aiming for the middle of the target. That membrane, you have to puncture that membrane.
It's
So-
a hard rubber stopper, so it's like boom, to get into it.
And you
We're
can
gonna
tell that
learn
we've
more the
used these
differences
bottles a
between,
lot.
like, the lidocaine needles and the filling.
Yes, you'll be able to look at them and see. Here, I'll pass my needles around.
The filling is the big
So,
one.
yep, the filling, look, just hold them in your hand and look at them. The fat one is your filling, the skinny one is what you want to be stuck with. Well, you might not want to be stuck with it, but you're patient. Okay, so then you've got all of your syringes. These are flush syringes, the 20 cc ones. So this is going to be part of your checkoff. When syringes come out of your package, they have a little air bubble at the end of them. So you're gonna take your syringe and you're gonna pop it so it's tight. You're gonna go into your fluid all the way, and then I need both hands. Becca does it one-handed, but I don't have the strength. So when with my
Becca did do it one-handed. Becca
Yeah.
don't know if she can do that anymore.
because I'm demoing, my syringe is all the way in that fluid, and I'm pulling up slowly against the bottom. The goal here is to have no air, because this is going to be injected into your patient's arteries. Air kills patients. So this is part of your test. When we teach that, did everybody just see that little air bubble that went up? You have all kinds of little air bubbles on here. This is why you don't go to the end of these. So as I do that, I make sure there's no bubbles. There's no bubbles. The only bubbles you see are on that black because we're using tap water, but there's no bubbles. This is part of your checkoff. You cannot have bubbles. No bubbles. No bubbles in your syringes all the way to the end. So when I use this, I'm gonna stop about right here, so I'm not getting those weird bubbles that are on the stopper. But there's no air in this, and that can be injected into a patient. Okay, will you hand me a catheter? I'll flush the catheter in a while. So you're gonna take from your circulator, your catheters. You'll learn the shoulder method once you get in. Becca and I can demo that for y'all. But as students, you're never allowed to do that unless you're at a hospital that says you can do it, but 99% of them will not let you drop your own catheters because they just don't trust us as students. So I leave my catheter on the card. I'm gonna hook up that 20 cc flush, and I'm just watching till the fluid passes through the end of the tip. And that means anything that was in there, microfilaments, whatever, they're gone. And then you take the wires.
So when y'all are opening one of these, there's a connection point. See where there's glue right there on the corner? You want to pop those off first. Just stick your finger in there and pop them off. The chevron is designed to make it where you hold it and open it up. So you start with that chevron and you pull apart, but you don't want to stretch to the point where you make the wire bounce. So then I'm going to get out of the way as much as I can.
Because wires fling
And
on
then
the
I'll
packages.
pull this down to protect her so she can get it out. But did you notice that I had to kind of do the package so she could get it all the way out? So if you're not careful as the circulator handing this off, what will happen is the scrub will try to yank the wire out, and you've got too much of a hold on it, and they're going to end up springing it out.
Or
And
they'll take the whole package out of your hands.
Yeah, and it'll end up contaminating them. So this is something that you guys are going to work on.
Yes, and these are expensive. So here's a good rule of thumb. If it has a port on it that looks like this, and it's on your table, it gets flushed. No port, no flush. Port, flush. So same concept. I'm gonna hook up my syringe, and I'm gonna go till I see fluid come out the end of that wire. It's a long way. See it come out? So that's flushed. So once everything is flushed, I'm also gonna have a sheath on here that needs to be flushed. I'll drop one for Becca, let her demo that. What else do we have? That
I mean, and
Depending
we'll
on
have the
case.
manifold and stuff, but
Yeah,
we're not
yeah,
going
no.
that far. Right now, our focus is setting this up. Okay,
Yep.
so based on what you've learned so far, tell me what I would find wrong with this table if you were checking off. The border, right? So this is wrong and this is wrong if you're checking off. But what she does is she automatically does the way she did it. So in real life, this is how she would set her table because she only has so much real estate, right? But when we're checking off, y'all aren't doing that because we will take points off for that.
Right.
Okay? So this towel just needs to be shifted so that it's inside that border, and this needs to be over so that I can see this edge, right? So I want to see at least an inch. So an inch, if you look at this first joint, is usually about an inch, except for you, Jaden. Yours is longer than mine.
Your
I'm
inch is
sorry,
like an inch
Caleb.
and a half.
Look at mine.
Caleb.
Look at yours. Look at mine. That's pretty close, right? That's pretty close.
Yeah, this, I'm not.
Mine's a
yeah,
little
this is-
smaller,
this is
but
pretty
this
much my setup.
section right here. So think about that. Every time you have a sterile border, I want you to think about that connection right there in your finger. Okay?
And so for me, yes, the book says 1 inch, right? That's what you learn. The lab that I worked in, I was against a wall, and there's another wall right here. So I know nobody's gonna touch me. So I didn't have to be over meticulous if I'm shifted to the edge, because I know nobody's gonna touch this. And I'm staying by my table. I ain't leaving my table. So, and I'm gonna use this first. So I'm still within my area and I haven't touched anything. So say somebody comes up and they touch my table, like I told you that happened during that STEMI. So what I did, because I don't have time to junk my table, so I grabbed a sterile towel the second they moved their hand off my table. I just folded it in half and I did this. In case I touch that spot where they touched, it is still sterile. And that is okay during a STEMI. If Jayco's there and they see you do that, that is okay, because during a STEMI you don't have time to scrap your table.
But an important note in this method is if anybody else is working on that in that area, you need to inform them. So say that happened before the cardiologist came into the room. The second he walks up to my table, I would be like, sir, we had a minor contamination here, that's covered, don't move this towel. Also, what I would do a step further is I would write with my skin marker, do not move towel. Don't move. Put an X on it, put a circle and a cross through it, whatever you need to do, but you need to inform your teammate, because the doctor might walk up and go, oh, thanks for the towel, and take your towel and dry his hands off. Well, then what's he done? He's just contaminated himself. Right? So you have to communicate with other people that are working with you. If I come in to relieve her a scrub in the middle of the procedure and she has something hidden or she has covered something, you have to communicate that to the person that's coming in and relieving you.
Oh,
Okay?
yes, I would be like, don't touch. Yes.
Yeah, I was like, I hope it's in
Let her
order.
know. Yes. I told Becca we came in here the first day and I set my teacup on the end and I was like, oh, I feel so weird setting anything on the sterile table because they look sterile, but they're not. It's just
Okay,
not special.
any questions about what she's done? So, did you tell them why you put this stuff on this
did.
end? You did, okay. I was doing something else.
Yeah,
All right,
you're good.
so I'll demo my table and then we'll put them side by side so you can kind of see.
And it's hard because I don't have everything. Like I don't have a blue bowl.
it's-
I'm like,
it's-
and there's 2 band bags.
it's all
I have
good.
a junk bag.
This was a different pack. So
Yeah,
this is a pack that
yes.
was donated.
Yes.
So the whole point when you are opening these packs is your goal is to try to only touch every item once. In the beginning, you guys aren't going to do that because you're not going to have a system, right? So you have to develop your system. You have to figure out your process and what order you want to put everything in. So when we go to tell you to set your table for us when you're doing your checkoff, I'm going to say your doctor will be approaching your table from this side, and I'm going to tell you what side. Because what that means is you need to have the gown and gloves at the end where the doctor is. So that's going to change the way you set your table. And then the other side should be where the needles and the access equipment are, right? What are you looking for?
I'm looking for the bag that had all the goodies. Oh, I guess it's right here.
The doodads in it?
Yes, my doodad.
Okay.
One thing I didn't mention is when you get your bowl, when you have your dump bowl, don't put your lid on it because it seals it. There is absorbent cotton in the bottom of these, so when you squirt blood or bodily fluids, it'll get absorbed in that, and so when it goes in the trash, you're gonna put this lid on it and it's gonna seal, and they're super hard to get off, so don't ever, because you won't be able to use your dump bowl. So use your lid like I did for your 4x4s, or however you choose to do it.
It depends on too where the bowl's from, because like some of them you can pop them back off.
Yes, some
but
of
they're
them will pop
supposed to
off.
be. That's the way they're supposed to be designed. But
To
we
not
know
pop
that
off.
depending on where they got their stuff from, I'm gonna take this to
I think, is it the yellow ones that
So
come
if
off?
you want to just roll to the side, and I'll pull this one out.
Okay, okay.